I've got two questions that I want Congressman to answer, both of them, and also, of course, the senators representative. And they represent a divide about opinion. How can yet another entitlement program be paid for when the additional legislation under Obama is not funded? Keep that one in mind, and then answer this one. Why is it not clear that decent, affordable health care is a constitutional right to life?
Yeah, I was going to say I didn't write the Constitution, so I'm not sure why it's not clear. But obviously, we believe that everyone should have access to quality, affordable health care. It says, how can yet another entitlement program be paid for when the additional legislation under Obama is not funded? I'm not really sure what that question means because Obama hasn't necessarily endorsed a specific piece of healthcare reform legislation. He's advocated on behalf of it, but he hasn't come out and said, I like the House bill or I like the Senate bill, or it has to be this way or that way. So I'm not entirely sure what the question means.
Guys, all I do is my question. Go ahead. Okay. Short. They passed stimulus. They're trying to pass cap and trade. None of this stuff is funded. Now we're getting another unfunded mandate as far as I can tell. And we're tired of it.
All right. I walked in January into the worst economic situation this country has been in since the Great Recession. We walked into an economy in free fall, to growing deficits, and to two wars that weren't being paid for. The stimulus is an investment in our economy. Listen. The fastest way to reduce the deficit is to turn the economy around. Because the greatest part of the deficit right now is revenue lost due to the recession. And I would happily get you the charts that break it down.
Well, why didn't you bring them?
But the best, give me your name on it. I've got staff in the back of the room. I'll be happy to send it to you.
Sir, we're not doing that.
But listen.
Sir, we're not doing that.
But listen, the vast majority of the deficit right now is due to revenue loss in the recession. When you're losing 600,000 jobs a month, as we were in November, December, January, and it's continuing. Not to the extent that we had, because we're beginning to finally turn things around. So we believe that it requires.
They want to shut down the tornado. How are we going to pay for this? 50% of the country is in debt.
Let's say goodnight.
Well, look, you can either stay out of it and let the economy recover on its own, hopefully at some point, and incur more of a deficit. But understand that is your choice. The deficit continues to increase because the revenue is being lost. Or you can try to make strategic investments to slow that recession and turn it around as quickly as possible. That's what we chose to do. In terms of, not that this is related to healthcare, But I think the American people want to reduce our dependence on foreign oil. I think the cap and trade bill, as it is passed, which is, by the way, a dramatic improvement over the cap and trade bill as it was introduced, will create jobs in the United States, will create jobs in Ohio, and many of us work to dramatically reduce the cost. We are using the private sector to do that through the cap and trade system, very similar to the NOx trading system that we use to address acid rain. If you read the Cincinnati Enquirer this morning, you would know that the alternative to legislation with regard to cap and trade is the Supreme Court decision that requires the EPA to treat carbon dioxide as a pollutant, and they do so. So that's why we move forward with the cap and trade legislation. Finally, when talking about the healthcare system that we have as proposed in 3200, I've already explained that the premiums in the public option would pay for the public option system. That's a requirement of the legislation. That's not an entitlement. When you're paying for your health care, that's not an entitlement. But that's what the bill says.
Thank you, and just will offer a gentle reminder that we're going to have a civil discourse. We're going to recognize and protect everyone's First Amendment rights, but we're going to do it in a way that does not infringe upon others' rights as well. Let's get back to health care. This is a question that I have because in my 31 years of service to working families and working people, blue-collar families, I work in rural areas oftentimes where medical care is hard to come by, where doctors are scarce. And that's becoming true outside of urban areas more and more often in our country. The question is, how can Obama's bill, well, I'm sorry, there is no Obama bill. How can let's call it health care reform. Let's say, how can health care reform cover 50 million new people without any new doctors? Jessica, you want to try that?
Sure, and this is a concern that we've heard from quite a few people and something we really did try to address in the Senate Health Committee bill. So this is a concern that we've heard from lots of folks that we tried to address in the Senate Health Bill. One, we increase access and funding for community health centers, which do provide so much service and so much primary care to individuals in underserved areas. Second, we have significant grant programs and graduate medical education grants to increase the primary care workforce in this country, which we think is an important part of healthcare reform. And it's not just for primary care, we do it for mental health care professionals, we do it for pediatric specialists. That was a big concern of Senator Brown, is that oftentimes people have to go really, really far to find a pediatric cardiologist. Not so much in Ohio because we have such great children's hospitals here, but often in other places in the country there's significant shortages, and we really do try to invest in our workforce. We have an entire title of our healthcare bill devoted to increasing the healthcare workforce in this country. And the other thing I would just like to note is that when we created Medicare, when we created Medicaid, when we expanded CHIP, we had to deal with these same type of situations where we have new people coming into a healthcare system. And it's not just that tomorrow, all of a sudden, the 47 million people in this country who don't have health insurance are going to all go into a primary care physician's office tomorrow. This is phased in over a couple of years. There will be time, we have funding streams coming, we have new access points. So it is something we took into account, something that we're very conscious of.
The Senate legislation does a better job than the House legislation in this respect. And I already mentioned that, again, it doesn't matter if you cover everybody. We don't have the doctors to handle it right now. This is seriously a crisis that we are facing as a country. And so while I certainly appreciate the efforts on behalf of the Senate, I don't think we've gone far enough in the House. I think we need to incentivize primary care physicians by addressing especially their debt coming out of medical schools and incentivize the programs